Probably the biggest challenge associated with getting a diagnosis of autism in your child, if you're a parent, is figuring out how to pay for services. And so even if you've been able to quickly identify the needed services, then figuring out how to make sure that your child can get those services and keep those services and make sure that those services aren't going to put a parent into bankruptcy is really a key next step for the parent. And that is an extreme challenge right now in autism. School districts, because they're the major source of education and treatment for children with autism, are really working hard to try to provide the kinds of services that are needed. Unfortunately, that right now that's very variable across school districts. So some school districts do a better job than others at that. For a parent, an important aspect of the process is making sure that your child has an individualized education plan. That IEP, or individualized education plan, is the crux of the child's services that they'll receive from their school district. And so that plan should not just focus on academics like reading and writing and math and spelling. It needs to also focus on some of the difficulties that that child with autism is going to have. For example, their social thinking and their ability to interact appropriately socially. If they have any challenging behaviors, they should be in that IEP and they should be addressed. There should be a specific plan to address that. Outside of the school district services, getting outpatient services from a mental health professional is also a challenge. And that challenge varies state by state because many states don't have designated insurance coverage for autism. So you'll really want to work with a provider, and you'll want to talk to that provider about what services do they offer. Is that service right for my child? It's okay for a parent to ask the provider what their qualifications are, how long they've been working with children with autism, what kind of approach they like to use in their groups, and to make sure that that provider can articulate that to the family. Because you may be spending a significant amount of money on that program, or you may need to have a very intelligent conversation with your insurance company about why they need to make sure that they pay for this program for this child. Unfortunately, many insurance companies do deny services for individuals with autism. There are insurance companies, though, that are starting to better understand the diagnosis and how it actually behooves everybody to pay for those services because the child becomes more functional and they may be less likely to use other services in the future. And so I think that that's changing over time. In fact, there are several insurance companies that do a very nice job now of providing services for individuals with autism and making sure that those services are appropriate and that they're evidence-based services, that we have science behind them. This is a major challenge for parents, and it really never ends. Even once you get one good treatment in place, that treatment may need to change in the future, and so you're still going to need to go through this process, whether it be with your school district or your insurance company.